but basically screening should be done around once in 2 years should suffice for women with average risk or a normal risk for breast cancer. And around 45 years, then we make it a little more intense. We tell them that it is mandatory to have a breast screening from 45 years of age, and we again advocate either a biennial or annual screening program. And from 50 years onwards, the same thing will continue, that is either once in a year or once in 2 years, depending upon the risk and depending upon what are the findings in the previous mammogram and everything. So, this practice will continue up to 70 years, and after that the screening normally we stop, but then again it depends on the general health of the women. If she is healthy enough, then we continue even after 70 years. It's not painful. I think all women are born with a relatively higher threshold for pain, and majority of us would have gone through labor and we know what pain is. Certain level of discomfort, that's all, but it's not painful. But the advantages are so much that I think it's mandatory and it's advisable for all women to go through. Average risk of any women for getting a breast cancer is about 10 to 12%. We say that the family history is positive only if a very close relative, that is your on the mother's side, mother and one more her sibling, or your very close relatives, first degree relatives, if two of them have breast cancer, then we put you at a higher risk. Or if because of the risk you have screened for your BRCA gene, then again that will take up the risk to almost more than 20%. And again, you know, history of ovarian cancer or colonic cancer, because these are all one family of cancers. If these are there in the family, then that puts you at a slightly higher risk for breast cancer. But just because you see there is a cancer in the family, which could be any cancer, a cervical cancer or a lung cancer or any other cancer, that doesn't mean you are at a higher risk to get breast cancer. No, it doesn't work like that. So, there are only specific cancers. If they are present in your family, in very close relatives, then alone it puts you at a higher risk. This I try to tell all the patients repeatedly, but somehow that level of fear exists within patients that they come and say, you know, someone died of cancer and I'm scared, but it doesn't work like that. These are very specific factors, and these factors have to be evaluated by the physician, and then only it will put you at an increased risk, but not just because one person in your family is suffering from cancer.